Welcome back. Let's now look at the end year health item here for you. The year is 2023. That year saw several changes instituted specifically in the health sector, with most of them geared towards catalyzing the attainment of the universal health care. The assenting of the 4 healthcare bills and the deployment, remember, of over 100,000 community health promoters that was launched by His Excellency the President was one of the highlights of the health sector. Our reporter Nancy Okware had a sit down with Public Health and Professional Standards Principal Secretary Mary Muthoni. Let's now listen to the report that she filed earlier today.
Kenya is in the process of shifting focus from curative to preventive and promotive care. It is a mode that has been hailed as affordable, as it begins at the community level to either arrest diseases early or prevent them. Public Health and Professional Standards Principal Secretary Mary Muthoni says that part of this entails basic practices by the public.
Preventive is what I can do myself. Afya yangu, jukumu langu. That I will be able to keep my compound clean so that the bushes around my household will not attract mosquitoes that will bite me and I get sick of malaria. That I'll keep a high level of hygiene in my household so that I don't get cholera. So waterborne diseases, that I'll treat my water, or I will boil my water so that I don't get sick. That I will take my child for vaccination and immunization at the right time and the right doses.
The rollout of the 100,000 community health promoters during the Mashujaa Day celebrations on the 20th of October was one of the steps geared towards cementing primary care. Each of the community health promoters dispatched to different parts of the country is armed with a kit that enables them to conduct basic tests and manage minor ailments at home.
They will come to your household. They will measure your blood pressure, blood sugar. They will remind the caretakers on when they need to take their children for vaccination. They will share with you the nitty-gritties, the small details of lifestyle diseases. And they will be able to equally encourage people in terms of climate change issues, plant more trees, because if we do not take charge of our climate change issues, then we will get diseases that come out of that, especially the respiratory diseases.
One community health promoter is tasked to serve 100 households and is paid a monthly stipend cost shared by the national and county governments. On the 19th of October 2023, President William Ruto signed into law 4 key healthcare bills. They are the Primary Healthcare Act of 2023, the Digital Health Act of 2023, the Facility Improvement Financing Act of 2023, and the new Social Health Insurance Act of 2023. It will replace the National Health Insurance Fund, and in its place, the Primary Healthcare Fund, Social Health Insurance Fund, and the Emergency, Chronic and Critical Illness Fund will be established.
The lowest level, that is the level 2, people will not be paying when they go to the health facility. Then when you get to level 3, then you're required to produce the social health card, where you pay 300 shillings to cover yourself. Your social health insurance card be depleted. You'll not be told you do not have money for screening or anything, and you have a chronic illness or a long-term illness. Then we will plow to the chronic illness fund. Therefore, that means even people with cancer, people who need dialysis, they can still be treated even if their card does not allow them.
On the other hand, the Digital Health Act will focus on making hospitals paperless.
Is supposed to intertwine, interlink, interrelate data into our health facilities, that we will not be walking around with the quota exercise book that we used to do before. You will not be going to a health facility and keep repeating stories of where you're suffering from.
The bill signed into law by President William Ruto will usher a paradigm shift in the legal and institutional framework for healthcare in Kenya.
The attainment of universal health coverage has remained elusive over the years. However, with a legal framework already in place, the government is confident that it will get it right this time round. Nancy Okware, Spotlight 2023.